Hey everybody, it's Dr. Rick and I'm doing an unboxing on ipratropium bromide. So this is a prescription, but I'm having a lot of patients call me with positive COVID or just symptoms of influenza. It's always important that you document this because moving forward, if you've had COVID, you will probably going to be protected with natural immunity for 6 to 12 months because you're developing antibodies right as we speak. So don't worry. And I think that this variant is showing that it's weak, watered down. Most of my older folks, 70, vaccine or no vaccine, just fly through this. Now you're going to feel crappy for a couple days. Whether you choose to do ivermectin or Paxlovid or fluvoxamine, totally up to you, and we can make that decision together. That you should be taking some vitamins. There's great benefit and there's hardly any risk, except for those of you who follow me on my YouTube channel. I have these as my go-to. Astragalus, red reishi mushroom, and butterbur, which is located Garden of Life. Butterbur is great for taking care of headaches, taking care of nasal stuffiness. Sometimes I'll use quercetin. In fact, the data was so strong with quercetin and zinc helping the cells not reproduce COVID. I've adopted it into my suggestions for the flu, but that's a lot of pills. And I know that some of you don't even take that many pills like I tell you to. To have you stop your vitamins and take a whole bunch of other stuff, if you can endure, I would do it. This is additionally what I use as far as a nasal spray, nadocromyl sodium. I use this for my patients who don't want prescriptions. I think it does help calm down mast cells in the nose and decrease swelling. You wouldn't think that you have to do anything for a nasal congestion, but you do. Because if you're coughing now and we try to beat the cough with your own immune system, getting boosted with natural immunity boosters, and you don't do anything for your nose, sometimes that leftover stuffy nose will cause persistent cough, and then somebody's going to question, well, wait a minute, you're not even changing because you're still coughing. Two reasons for cough: chest and a nose. I would do the stuff for the chest to take care of your immunity so it takes care of the infection fast, but I also do something for the nose. Turn everything off so that you're not fooled as things sometimes progress. And that's the difference between COVID now, which usually runs its course in 4 to 7 days, and then the influenza strain now, which is running its course in like 2 weeks to 3 weeks. So get your tests if you can. But if you're one of my patients, get on the Get Healthy portal so we can figure things out. I'd rather use this ipratropium bromide, which is a prescription. And if you don't have prescription coverage, you can still get 0.06% with the Good RX coupon at, I think it was $11. I used to use this when I worked for USA Boxing, taking care of the fights downtown. So whenever I had a kid with a bloody nose, they get stuffy and broken, and sometimes it's hard to breathe at night. Well, this takes care of the swelling, and it also stops the bleeders really nicely. Some people consider this too strong. I thought it came down with influenza, so I started to deploy my usual triplet, and instead of the nasal crumb, which is mild, I went to this. And I just used it one day, and it really reversed everything. In fact, it got me too dry. So I had to stop, but it held me out for at least 3 to 4 days. I would use this 2 sprays each nostril 2 to 3 times a day. And I usually suggest, when I prescribe it, that you rinse out your nose with nasal saline first, get all the crap out of there, clean up the lining from snot, and then you spray this thing. It does taste like medicine, so it kind of burns, and then you can feel and taste it in the back of your throat, but it turns off the swelling nicely, especially if you don't want to mouth breathe all night and you wake up with a sore throat and a stuffy nose and a cough and you're not sure, okay, what's what? Is it another infection coming? Is it strep throat? So again, I would do your best to take care of the postnasal drip. 2 capsules of Garden of Life Sinus Immunity, 3 times a day is what I do. And then reishi and astragalus. Reishi is a mushroom, astragalus comes from a root, but both of them have been known to be adaptogenic, so they improve your immune status. 1 capsule of astragalus and 1 capsule of red reishi mushroom 3 times a day. So you're going to be busy. 3 times a day, 3 times a day, 2 of these 3 times a day. The nasal spray at least 3 times a day, and if you're just opting to do nasal crumb because it's over the counter and you can't get your doctor to prescribe it, this is fine, but 2 sprays 3 times a day, and you can get this on Amazon. All this stuff you can get on Amazon except for this. If you are having problems with a sore throat, I just love Host Defense. So this is MycoShield by Host Defense. And yeah, it does have a little bit of alcohol in it, so you can't give this to little kids, but it also has different mushroom blends. And if you spray this into the back of your throat, Why, 2 to 3 sprays every 2 hours if you had to. It will, number one, numb up the back. So maybe that's all I get. Maybe that's the benefit, but it also fills you up with these mushrooms. And we're talking about symptoms here. So we're talking about decreasing postnasal drip and being able to breathe through your nose at night. Talking about not having to swallow like you're swallowing razor blades. You can do Tylenol in addition to all this, or Advil if you choose. I did throw 2 other things in here because a lot of people with COVID or influenza will either have a stuffy nose, a sore throat, or a cough. And the data was made popular during COVID times, NAC, by Now Food, 600 milligrams twice a day. Good, I'll put a link to the video I did. And I have not done any videos on this one. This is pelargonium. Pelargonium helps to reduce the symptoms of bronchitis faster than doing nothing at all. So whether that's placebo or not, pelargonium is a homeopathic drop, 1/2 to 1 dropper 3 times a day. And beauty is you can use this for kids as well. You have to ask your pediatrician. This is my usual go-to. If you have no cough and no postnasal drip, 3 times a day. If you do have postnasal drip, it's either you add your nasal naloxone sodium or you ask your doctor for Atrovent or ipratropium bromide. If you happen to have a sore throat, you can also use the throat spray. If you have cough, then you can use the NaC and or the pelargonium. Some people use Tessalon pearls, some people use Robitussin with codeine. That's totally up to you, but those 2 are prescription. I think this will get you into a good way. If you also, or you're undecided on whether you're COVID or not, there's no problems with using this and then doing the COVID supplements, which would be vitamin C, melatonin, zinc, quercetin, and vitamin D. So those are the usual things for COVID, as made popular by the FLCC's vitamin protocol. Since it's influenza ramping up, I go back to my concoction of how I have a fast rescue. If you have your options on what you like to use or side effects that you found, please put them in the comment section down below. Please try to stay healthy this season. There's going to be a lot of festivities, and you would think that people wouldn't come to your gatherings if they're sick, but you know, everybody's ideas about what is sick, what should I stay away with, be careful. If you have to go to a party and you can't avoid the person that's coughing, just put a mask on. That's fair. Little kids do fine. It's the adults, middle age and older, that don't do fine. But I think it's important to just protect yourself from what can be coming. And those of you who are in the area, on January 14th, I am having the Ignite Your Life conference, and it'll be talking about how to make changes for 2023 to be your year to break away and start getting healthy. I'll put the link down below. Stay healthy. See you at the next video.